So I brought general what naturopathic, what we do and provide at the clinic. So for myself, I see everybody. I give an hour and a half first consult, and I do also have a biofeedback machine that kind of just gives me insight to the patient. People love seeing reports. They love seeing themselves on a computer screen, and then when they come back, they can actually see the improvement. I also mail out, they get an email 35-page report on the on what the biofeedback said, so they can have something to take home, and then when they come back, see the improvements on their body. I can honestly say when I started practicing 15 years ago, I didn't like the machine. I didn't trust the machine. I got it because I was joining a practice where it was highly advised. It took me about 5 years to meld with it, and now I really like it as a tool to kind of look at a person's body and have a way of assessing its overall health, and then showing them this is what you look like from a computer's interpretation, and then what our goals would be. And sometimes things show up that they haven't mentioned to me, and then I can ask them about it through the biofeedback machine, and then people love taking that report home. So over the years, I've done different talks and evolved in my practice. I would say one of the first talks I ever gave was on IBS, because this is huge with naturopathic medicine. It's also probably the reason I became a naturopath. I had traveled a lot, got myself into dientoamoeba, giardia, so I had a very sick gut. I was also one of those people that would crash. I could never stay awake in school, and I couldn't figure it out. And it turns out I just don't do well with certain foods. So as far as energy issues with a lot of my patients, diet and nutrition is an absolute, and I see a lot of gut issues. And so it's one of my favorite areas to work. I always feel like it's an easy day when it's a gut day, because I had tons of experience from myself and in practice over the last 15 years doing it. Thyroid disorders we see a lot of. A simple solution for a lot of my patients is just put them on iodine. We did testing, I don't know if it was 400 or 4,000, it was an outstanding amount of numbers. 97% of us are iodine deficient, and often just introducing iodine into the body does a massive improvement in energy and making us run better. So I gave a talk on the library over that and encouraged people just to do something as inexpensive and simple with that. Obviously, diet and nutrition is going to be huge. There's nothing that would have gotten me not falling asleep during interviews or classes or anything unless I changed my diet, and for me it was gluten. Yesterday I had pizza because it was my daughter's birthday. I was in bed by 8, comatose, going like, I'm sorry, your kids are going to have to go to bed. My spouse was out, thankfully, but 7 kids in my house, and I'm like falling asleep going, God, I still can't handle much gluten. So 4 years ago I introduced IV therapy. There's a huge demand for it. There was nothing available till recently nearby. So it was a practice that I started out of necessity and to provide extended care to cancer patients. It's such a great adjunct treatment, or if you are choosing just to do IV therapy for cancer treatments, it's been a wonderful addition. I've seen a lot of improvements with different patients. I don't only do cancer patients, I do optimal nutrition. I find a lot of athletes will come and get a Myers cocktail and go for a good run and feel a huge improvement. I use it on myself. There's a kind of a standard treatment. If I get sick, one day I had a student that was practicing, everybody canceled because it was a snow day, so I had an IV. I woke up that morning feeling like crap. The next day, same thing, still snowy, nobody came in, so I'm like, I'll have another IV. No cold the next day. So it's kind of I always post, are you sick? Come for a quick, not inexpensive, but quick 2-day fix, and it knocks the cold out of me. I've tried this 2 to 3 times now, anytime I've gotten sick, and it wipes out the cold. So for anyone with like chronic illnesses and they just can't shake it, I highly recommend IV to get that extra boost. I had a 86-year-old patient that was sick for a long time. She just couldn't get that extra, so it pushed it out of her. So there's a brochure on our IV. Breast cancer, just because it's almost 1 in 5, I think the stats vary from 1 to 7, 1 in 5. Women that get breast cancer is such proactive, if you can be proactive through simple measures, it really can help cut down the risk profile in such a huge instance that I gave a talk on that in the library. I do lab tests, which most of us will do, food allergy testing, because people often want to know what's making them sick. So Rocky Mountain, and thankfully they are also now bringing in a hormone test as of October 20th, so we don't have to go through the states anymore, which is Dutch Labs. And they're also, I think they already have fecal matter testing. If you're wondering what little critters or what disbalance you have in your gut, they do testing now too. So thankfully, Rocky Mountain Analyticals is providing us with more resources to help get to the root of our cause. I don't think you can do anything unless you're going to deal with diet and nutrition, and sometimes when I have patients that come in and you could tell they're resistant, I'm like, it's really the foundation of health. So anyway, we're just located down the street, and recently I brought Fiona in because it's something she's really keen on. I feel like as naturopaths we get a certain amount of training. I do find great value in it, but having an addition to my clinic and someone who can provide I don't do cupping, and it's something she did and has a little more life to our clinic, having someone to work with. So I'll let Fiona take over from there, and I'll leave these for anybody who wants them. Thank you.
Okay, so I am Fiona Meng, and I have a bachelor's in psychology, and then I went to study Chinese medicine in BC, and I did that for 4 years, and now I'm here. So I have some notes. I have slides, but they're boring, so I'm just gonna paraphrase. So I wanted to talk about what it is that we do in acupuncture that is the same as what we do in naturopathic medicine and what is different. So the biggest thing that both naturopathic medicine and Chinese medicine are doing is we're looking at the entire body. We're seeing, okay, so we're taking a look at, is this person exercising? What's their diet like? What's their lifestyle? So that way we can find what the problem is and direct our treatment in that way. So instead of just going to the doctor and saying, okay, this is the problem, here's a pill for that, we want to figure out the reason behind that, so that way the body can adjust itself and learn to heal itself. So what is acupuncture? So basically what we're doing is we're taking these little needles here. So they're really thin needles, and usually the needles that we use would fit inside of one of those needles that is used to take blood. So they're super thin, they're not painful, or rarely painful when you put them in the body, and we use them so that way we can adjust the meridians in the body. And the meridians is this system that connects through the organs, through the blood vessels. It connects to the brain, it connects all the way down to the feet, and it just cycles through the entire system. And when we access the meridians, we can change the flow of energy. So that's essentially what we're doing with Chinese medicine, is we're adjusting the flow. So if there's a blockage somewhere that's causing pain, or sometimes it's an emotional issue or a physical discomfort, we can adjust it and bring the body back to its natural balance. So, okay, so this is my science note. So they've done a lot of studies about acupuncture, and they've really brought it down to 3 potential ways in which it works on a scientific level. So like I talked about the meridians, so these are the pathways that run through the body, and interestingly, they've actually proven that these exist. So up until now, they could not find them, they did not see this, and they didn't really believe that they existed. But a bunch of Korean scientists discovered the existence of these meridians, so now it is more commonly accepted that these people who discovered this, 2,000 to 5,000 years ago, they actually knew something. And then some other studies that they've done, they know that when you put an acupuncture point, or when you put a point into the body, so when you use a needle, you put a point in the body on one of these acupuncture points, it releases endorphins. So that's going to trigger the brain to decrease pain, and it also can create a euphoric sensation. So often when people finish an acupuncture treatment, they feel super relaxed, and they kind of just feel like a sense of euphoria, and they just want to go to bed. So the other thing is that acupuncture can also trigger the nervous system. So it interrupts pain signals to the brain. So that's why one of the reasons why it's very commonly associated with pain relief. What else do I have here? Another thing is the World Health Organization has tested many things to see what is effective treatment for acupuncture. And out of the 122 things that they treated, so it was an intense study that was done over the course of years, they said it was effective for over 117 different conditions. And that's not a complete list. That is only what has been scientifically tested and proven to have an effect for. And there's a huge variety of things that we treat. So we treat emotional symptoms, mental symptoms, so mental fatigue. We also do a lot of pain management, back pain, we do knee pain, all sorts of parts of the body, allergic rhinitis, so allergies. We do cancer, depression, dry eye, headache, tons of stuff. And yeah, that's what I've got so far.
So I have a question. Are you aware like there is like cupping with some kind of acupuncture?
Yes.
Like, can you tell about that?
Okay, so we do acupuncture with some cupping. Typically, we're not going to leave the needle in while we put the cup over. And this is going to help draw out even more, sometimes blood. It can help bring what we call like heat from the body. So this could be things that are causing pain. So it can help to even have a greater effect at taking pain from the tissue and bringing it out. Yeah, that's how we typically use it. It's a little bit different than they would use it in naturopathic medicine, because what we're seeing is less of a Western type of mindset, and we're kind of looking at things, at patterns in a really specific way, which is more based on these sort of Chinese traditions.
You also use a flame when you're doing that.
I do.
Yes.
That's my favorite.
Is it the same idea as using dry sucking as opposed to the flame?
It's really like a circus act. And then it just puts it on, and it's like, wow, it's a dance.
It's a little different, and it's similar, but then it is a little bit different, because from our perspective, what we see the cups as being most useful for is if there's what we call cold stagnating in the muscle. So the heat and the flame can help draw that out more. So it's kind of how we're using the tool. Obviously, we still find it useful for muscle pain and really helping to release the tissue and the fascia. But from our perspective, that's not exactly the same thing as what our intent is.
Any more questions? Thank you very much for your presentation.
Thank you.